very quiet until then.
Thank you for that, Will. Good evening, everyone. A very warm welcome from the Australian National University here in Canberra. Sorry, I'm getting an echo. I hope that you and your loved ones are keeping safe and healthy. I think all good. We've lost the technical issues there. I'd like to acknowledge the Gunawal and the Gambri people who are the traditional owners of the land where ANU is located. I pay my respects to the elders past and present. I am Dipti Patel, clinical hematologist and program lead for the ANU COVID-19 peer support program. Joining me today is Devashi Paliwal, a medical student volunteer from the ANU Medical School. We are very pleased to welcome attendees from various parts of Australia and the globe today. Knowledge is power, and our weekly webinar series allows us to share and learn from each other's experience during the pandemic. Before I introduce our speakers and the topics they are going to cover briefly, just a few housekeeping rules. All attendees will note that they have their videos and microphones switched off. This is just to help keep the sound quality clear and reduce interference during the webinar. We encourage attendees to ask questions using the Q&A button below their screens. You can ask questions anonymously if you wish to do so, and feel free to post your questions at any time. Our speakers may answer them during the talk or get to them at the end of the session. Please note that the talk is being recorded, and if you do have any feedback or technical issues, we might not be able to help you in real time, but please do drop us an email at international.health@anu.edu.au. With that, I'd like to briefly introduce our speakers and the talks for today. I'm delighted to have Professor Mark Howden, who will talk about the impact of the pandemic on greenhouse emissions, followed by Dr. Arnagretta Hunter, who is going to tell us about the health impacts of climate change. And lastly, we will have Dr. Will Grant, who will provide insights into the short and long-term impacts that the pandemic has had or will have on climate change. I'll get Devashi now to do a more detailed introduction on our speakers, and then we can start off. Over to you, Devashi.
Thank you, Deepthi. Hello, everyone. I'd like to begin by starting to introduce our very first speaker, and that's Professor Mark Howden. He's the director of the Institute for Climate, Energy and Disaster Solutions at the Australian National University. He's also an honorary professor at Melbourne University, a vice chair of the Intergovernmental Panel on Climate Change, IPCC, and the chair of the ACT Climate Change Council. Mark has worked on climate change issues over 30 years, addressing agriculture and food security, the natural resource base, ecosystems and diversity, energy, water, and urban systems. So over to you, Mark.
Thanks very much, Devashi and Dipti, for the introduction and the opportunity to speak here this evening. So I'm just going to cover briefly a little bit about what we might have learnt about that we could have done in relation to climate change and COVID, and perhaps what we didn't quite succeed in. And so there should be a full screen there. Is that all good?
Yeah,
okay.
Perfect.
Fantastic. So what I'll, the first point I'll make, and this is just a fairly short presentation, is that if we actually look at greenhouse gas emissions, which have been going up for a long time, so this is carbon dioxide from fossil fuel and industrial sort of activities, we can see that it's going up very significantly, a big reduction there for the global financial crisis, but a very temporary one. And if we come up to recent times, we can see a very substantial reduction in greenhouse gas emissions due to coronavirus, due to COVID. So that's that solid black line at the top of the page there. So that coronavirus lockdowns significantly reduced greenhouse gas emissions by something between 5 and 6% across last year. And so that is unprecedented in terms of the emission reductions. And so it had a big impact. When we actually disentangle what happened, most of that impact was through reduction in transport activities. So people were locked down, they couldn't travel, so there was fewer cars on the road, fewer trucks on the road, and those emissions reduced significantly. Really importantly, if you actually take that emission reduction that we saw in COVID and did that year on year on year, we'd actually be heading to where we need to go in terms of climate change. So that 5 to 6% reduction, if we did it year on year, would actually take us close to a net zero by 2050 target, which is what we need to do to keep temperatures within range of 1.5 degrees. So that's why I think people got excited in terms of that linkage between COVID and climate change early on in the pandemic, because they could see these emission reductions and the prospect of actually going on a different trajectory of greenhouse gas emissions than the one we've been on self-evidently from this graph. At the same time, I think people were talking about this as an opportunity to develop new industries and new ways of making money, new ways of engaging people in worthwhile and important, highly paid jobs. And so in fact, the discussion about a green economy at that point was very, very substantial. And there was a lot of commentary last year about the prospects of actually using COVID to jumpstart this green economy. At the same time, we had reports like the IPCC Working Group 1 report, which really illustrated the urgency of climate change action. So that report basically said that under all emission scenarios, we're likely to pass 1.5 degrees somewhere in the 2030s. And if we go on the high emission scenarios or keep on those high emission scenarios, it may even be this decade that we pass 1.5 degrees above pre-industrial. So there was that sort of 10-year frame for indicating urgency. And when we look at the carbon budget, the same sort of 10 years popped up, that we can only have about 10 years emitting at our current rates and still be consistent with staying below 1.5 degrees. So that urgency message was coming through in the public discourse, weighing into that prospect of a new green economy. And importantly, what that IPCC report showed is if we actually do stick to a low emissions scenario, we can actually reverse climate change. Yes, it does temporarily overshoot 1.5 degrees, but then it starts gently to come back down. So we can turn back climate change if we responded effectively, if we kept on that low emission trajectory. And even Business Council of Australia, like fairly, in a sense, conservative organisations were actually calling for really significant action on climate change to head off these problematic futures. Now, around about 18 months ago, in the fairly much the start of the pandemic, at least here in Australia, I actually put together a presentation, and these next 4 slides are actually from that presentation. And in a way, it was quite prescient because it forecast a lot of what the issues might have been coming up in relation to that comparison of climate change and COVID. Now, without going into a lot of detail on this, but that presentation is recorded on the web, but you can see it on our ICED's website. Firstly, I said, is there a basis for comparing COVID and climate change? And established it, yes, there was a basis in terms of, the global nature of it, the severity, the need for effective collective responses. I looked at the rationale there in terms of action. And really said, basically, in both cases, early action is good action. Getting vaccines out and getting public health measures in COVID is really good action, heading off the development of large caseloads. Similarly, early action on climate change is good action because it prevents those substantial climate changes and the feedbacks from that, which continue climate change. And I made the point that informed early action is even better when you actually have good science and good economic analysis and good policy analysis coming into play to inform that action. And in some ways, we've seen some of this happen in places like Australia, where we did have significant scientific and medical input into public health measures. But gradually over a period of time, that got eroded and it got politicised. And you can see that the sort of fingerprints of politicisation right around Australia now in terms of that COVID response, similar to the politicisation of climate change. And that itself starts to become a real problem because it actually starts to fracture the community rather than unify community in common action. I talked about how we needed to deal with uncertainty and the importance of looking at the costs in dollars and the costs in lives and not trying to do a trade-off, but actually find a way through where you can actually save lives and save money. And it was really interesting that subsequent to this presentation I put up, the evidence has become really, really clear that those countries which mounted an effective public health defence against COVID not only saved lives, but they were economically much, much better off than those countries which didn't. And the same goes for climate change. If we can head off climate change, we'll be much better off economically and we will save lives, not just human lives, but lives of other species all around the planet. I pointed out that inequality and denial really matter in both cases. And as it's turned out, inequality and denial are really significant in COVID, just like they have been in climate change. Those forces, including social media manipulation, have started to split our communities and result in inequitable outcomes for people. And the denial component has actually generated significant problems of its own, as we can see in Victoria with the spread of the disease in Victoria. And the last point I made in that presentation was the importance of an integrated long-term response, not to just take a short-term response. And that really involved individual and collective action. So combining those two, particularly through effective policy and leadership. And if we actually look at that, part of that discourse had to be about where we wanted to be at the end of the COVID pandemic. Did we want to snap back or bounce back or go back to normal, which was the language which was being used at the time, going back 18 months? Or did we want to bounce forward? Did we want to rethink and redirect our economic trajectory to actually become what was much cleaner and greener and safer for the planet? There was questions about, would ideology get put aside because of the massive economic stimulus that happened here in Australia? Years and years of deficits being bad was thrown out the window almost overnight. And we went into a situation where massive amounts of public expenditure were made in relation to COVID, almost unbelievable. You know, the error term in the one of the policies, about $60 billion, by itself would have been enough to effectively decarbonise Australia's electricity system if you leveraged it with private investment. So these are huge numbers which are comparable to solutions for the whole climate change problem in Australia. So there was a real significant basis, I think, for comparison here. And unfortunately, what happened in that time, that quite fluid time early on in the pandemic in Australia, is that instead of heading on that green trajectory, we head on a gas-led recovery. And we're still, in a sense, trying to recover from that sort of set of ideologies that were put in place at the time. And even 18 months ago, early on in the pandemic, various scholars were pointing out that there was a whole series of ways of expending public money that would generate not only benefits for COVID, but also long-term benefits for people and for the economy and the environment. And this is just one example of this. I think came from Oxford Uni or Cambridge, I can't quite remember. But the clear messages that came from that is there's some good ways of spending public money to deal with COVID that would have that longer term dividend. And some of these were clean physical infrastructure, building efficiency retrofits, investment in education and training, natural capital investment, clean research and development or research and development in clean energy, and rural support spending in some countries. So those were things that a long time ago in the pandemic were being flagged as really, really positive ways of spending public money. And I've just put a very quick, very subjective assessment of how we've gone in Australia against each of those. Did we invest in clean physical infrastructure? No. Did we actually invest in building efficiency retrofits? No. Did we invest in education and training? Quite the opposite. We've had massive numbers of staff losses in our university system. Did we invest in natural capital? Maybe a little bit at the margins, but much more in terms of fossil fuel infrastructure. Did we invest in clean research and development? So research and development in clean energy technologies, adaptation to climate change, as a way of moving us forward post-pandemic? No. We actually put more money into the gas, into fossil fuel-based hydrogen systems, carbon capture and storage. That's where our technology investment for climate change has gone. And did we actually spend comprehensively and efficiently in terms of levelling out the differences between our rural sector and our urban sectors, or investing in natural resource base in those rural systems? No, we didn't. So I think my assessment here is, whilst there is actually a really good a priori comparison between COVID and climate change, a lot of the responses that we had in COVID in terms of rapid response, evidence-based responses, if they translated to climate change, we'd actually be much better off. But unfortunately here, largely, they didn't. So as a consequence, and this is my last slide, instead of going on that trajectory downwards, that dotted line or dashed line trajectory that I showed before, this is what's happened across the globe. We've actually bounced back to pretty much exactly pre-COVID levels of greenhouse gas emissions. And my expectation is next year will be higher than those pre-COVID levels of greenhouse gas emissions as we go into the economic bounce back, because here in Australia and globally, we haven't invested in the future. Thank you.
Thank you, Mark. That was a really informative talk, broadly covering all the various aspects of COVID-19 and climate change, and so much to be done. Thank you. I'd now like to invite our next speaker, Dr. Arnagretta Hunter. She's a physician, cardiologist, and the Human Futures Fellow for the College of Health and Medicine. She has a range of interests, which includes the health impacts of climate change. She's also the chair of the Commission for the Human Future and is a co-host of Policy Forum podcast from the ANU's Crawford School of Public Policy. Over to you, Anna.
Thank you so much. And thank you, Dipti, for inviting us into this conversation today. I've been really looking forward to catching up with my friends and colleagues and for sharing our ideas. I'm going to share my screen. Right, just give me 1 second. Last time. Let's see. I apologise for this. We did test it before. Did something funny. There we go. Excellent. Just maximise it. Good. So I think Mark Howden's just done an extraordinary job, as he always does, in helping us to understand climate change and to understand where we're standing in terms of our carbon pollution and the sorts of challenges that we might face ahead. And what I'd like to do now is to take us through a few ideas around the health and the environment, how we might approach the challenge of climate change that might lie ahead, or that has already impacted for many of us. So I'd often start these conversations with reflecting on a particular summer, and this actually is not the bushfire summer of 2019-20, but the summer beforehand. I'd been thinking about health and climate change for quite a while beforehand, but there was a particular period in January 2019 where, for me, that conceptual leap of the potential health impacts of climate change became apparent as very much as a lived experience. January 2019 was around 6.3 degrees above our long-term average here in the ACT. It was a much hotter than usual summer. We had 5 days over 40 degrees in a row, which was, again, an unprecedented sort of an event. And for reference, the period from 1960 through to 1990, there were 3 days over 40 degrees in that period, 3 days in total over that period, in contrast to 5 days in a row. And I remember going back to work probably around the 12th or so of January, and you can see from the temperature chart there that that week and then the week after and then the week after that were all extremely hot periods. So I'm a cardiologist, and I spend time talking to people about how they feel when they're exercising, how short of breath they might be, or what sort of symptoms they get. I also talk to people a lot about the health benefits of exercise. And I often encourage my patients with heart disease or lung disease or other comorbidities to spend a little bit of time each day in some sort of physical activity, walking around the block or going to the gym or something more structured. And what I really found during that period was that the routine health advice, the sort of management advice that I would give to all patients most days that I'm seeing them, really was flipped on its head. I remember riding to work during that period. I ride my bike usually into the city here in Canberra. And around 7 o'clock or 8 o'clock in the morning, it was getting to be too hot for active transport. Actually exercising during that period, even when you timed it well according to the temperatures, it was quite a difficult period. So we know that that summer was an extreme weather event. That was a heat wave that we've never experienced in the ACT before, both in terms of its intensity and its duration. And those sorts of events have been made so much more statistically likely by the increase in carbon dioxide in our atmosphere. So just going through the health impacts of this, when I tell people not to exercise, it makes me uncomfortable, and I worry about it, because not exercising has a range of different health outcomes or health impacts. It changes how our muscles work and our muscle tone and strength. It changes metabolic indices, like how we metabolize glucose, or how our insulin regulation works. It changes heart rate and blood pressure. It has mental health impacts, and I think we all understand that from the periods of lockdown that most of us have now been through. Bowel and bladder function can be impacted. Managing conditions like congestive cardiac failure and COPD can be much more difficult during very hot periods. And activity is an important part of maintaining those sorts of conditions. And so if you have a patient with advanced heart or lung disease and they're inactive, it's usually in the context of a hospitalisation, but if they're injured and sitting on a couch for a month or so, it can take a very long time to recover. And in fact, some of those patients never return to the baseline function. We know that exercise reduces the risk of falls, and not exercising increases the risk of falls. And so it's a longer term, sort of medium term impact after a long period of inactivity. I think most importantly, exercise is one of the most important anti-aging interventions that we have available. There's no drug substitute for this. And so when we don't exercise, we find that we become more frail, and it can accelerate that aging process that many of us are trying to avoid. So that got me thinking a lot about how climate change and how the increase in extreme weather events may actually seriously impact on the health and well-being of my patients. And I've been working in the area now for a while, and I quite commonly get asked why environmental issues should interest doctors. And so just to take you through, I guess, the things that happened after January 2019. Well, we had that awful year of 2019, starting with the heat waves in January. It wasn't just a heat wave in January. We went on through 2019 to have a rainfall year, which was unprecedented. The Australian rainfall average has never been that low in recorded history. And so we had essentially very little rain across particularly the eastern part of Australia. We then went into a summer period, which was hot and extremely dry. And the bushfires, of course, started in Queensland in September, and the bushfire spread slowly down the eastern coast of the Australian continent, really along the line of the Great Dividing Range, a big mountain range that is well known to us all living in these states of Queensland, New South Wales and Victoria. The fires lasted for months. It was an extraordinary summer season. And the air pollution that we experienced, particularly here in the southeastern corner of New South Wales and the ACT, was unprecedented. We've always had bushfires, as our Prime Minister said at the time, but we don't usually have bushfire smoke like this. And that's usually because our bushfire events are discrete, they last for a day or two, and they resolve with rainfall. This summer was extraordinary because it didn't rain. And the bushfire smoke lasted for months at a time. We had hazardous air pollution here in the ACT that started in November, December, January. And at various points in that period, we had the dubious honour of having the worst air quality in the world. And so I remember at the end of that summer thinking, how on earth can that continue to happen? I do understand the climate science, and the climate science tells us that there will be an increase in extreme weather events as the temperatures rise. But I have to tell you, emotionally and psychologically, it was extremely difficult to get my head around the idea that that sort of summer could happen again. And so if we go through to the middle of 2020, when we were beginning to battle the global pandemic, this was, of course, some photos that were taken from the west coast of the United States. And this is photography from California over their summer. And the sky looks the same. That apocalyptic sky where you can't see the sun, where the sky that's usually blue has turned orange or red. And we can see that these environmental events will continue to occur. Let's move forward a little bit to 2021. And this year, obviously, we've seen, again, further extreme weather events and are beginning to understand that the health impacts can be quite profound. I've been interested in heat for quite a while and thinking about the biology of heat and how we can better prepare for heat waves, particularly where they're of longer duration and of higher temperatures. And of course, we saw two significant heat events in 2021. One was in Pakistan, where cities that are used to having high temperatures hit what might have been described as boiling point, a point where the biological limit is reached, where human life is really threatened by very high temperatures. And there was an unusually high mortality in that region at the time of the heat waves earlier this year. Similarly in the United States, so in a well-resourced health environment, including Canada and the USA, we saw a very high mortality from that heat dome effect that occurred over the west coast of the United States and into Canada. And of course, they set up some cooling centres in the same way that for the summer smoke, they had safe rooms for breathing, constructing urban environments where people could seek refuge from air quality. They also created urban environments where people sought refuge from heat. And yet in that particular heat wave in the United States, in a well-resourced system with well-resourced people, many hundreds of people died directly from heat. And so this is beginning to give us some insight into what might be ahead. In 2020, some colleagues at ANU and I did some work on climate change, on the way in which we think about the environment and health. And we were particularly commenting on the health impacts of heat waves. And we don't really reflect it very well in our health data. And so we had a little conversation around whether we should add climate change to death certificates. When we think about those people who died in Canada and in the United States from the heat wave, and some of them died suddenly, I know as a cardiologist that on their death certificate, the high likelihood that the cause of death will be written down as cardiac arrest or heart failure. And so for my profession in cardiology, we're highly likely to see a rise in mortality, cardiovascular mortality, which is directly attributable to environmental issues of temperature, environmental issues of air pollution. And so as a profession in the healthcare industry, we really need to think about how we can account for these environmental issues. How do we account for the health impacts of climate change? How do we account currently, how can we account for the health impacts of climate change? And we've been doing a little bit of work with the Australian Cardiovascular Alliance and talking to colleagues at the Institute of Health and Welfare here in Australia about how we can measure and begin to better appreciate the health impacts of climate change or the health impacts of the environment. How can we better understand this relationship between our health and well-being as humans and the environment in which we live? And so, do we need to do that? That's the last question. It's a really interesting question, and I still have colleagues who are asking me that question. I think the answer is quite clearly yes. So what sort of frameworks have we got in health to think about the environmental impacts? Well, this is a fantastic model that comes from the Lancet Countdown on Climate Change in Health, but they take us through a series of ways in which the environment, and particularly thinking about greenhouse gas emissions, the way in which that influences health and well-being. There are changes to temperature, changes to rainfall patterns, sea level rise, extreme weather, particulate air pollution, and ocean acidification all have flow-on effects through complex mechanisms sometimes into human health. And the sorts of health impacts we see are changes to our nutrition, impacts on health and well-being, cardiovascular disease, respiratory disease, infectious diseases, and vector-borne diseases. And of course, these environmental variables also can work through the social determinants of health, which are significant. I also think that the Kate Rayworth donut is worth thinking about. And so Kate Rayworth has an economic model which overlaps with human well-being. And this is actually from her publication in The Lancet, which is a medical journal, looking at the biological limits and the social foundation where we can stay well as people without causing environmental harm, which has that negative feedback loop to affect our health and well-being as people and the planetary health more broadly. And so what I think we're beginning to much better appreciate is that whilst our medical schools and our health environment has traditionally, at least for the last few decades, been fairly strongly focused in on the biology of disease, on making a discrete diagnosis of cardiovascular disease or heart disease, lung disease, diabetes, coronavirus. That in fact, that biology of disease takes place in a much more complex environment. The social determinants of health we know play a profound influence on the biology of disease and particularly on the ways in which diseases progress. We particularly have been seeing this, I think, emerge as a dominant issue in terms of coronavirus infection, as we see that things like the built environment, the places that we live, influence the risks of infection. And the final element to this model for health and well-being is the environmental influence. And it's the area that has probably received the least attention in terms of our health data. And yet, as our climate changes around us, as global temperatures rise, as we see an increase in extreme weather events, it's that environmental influence which will grow in terms of its health impact. And so I thought I'd just share with you quickly the framework that I've been thinking about and working on with colleagues over the last couple of years, a framework for describing and thinking about the environmental health influence on health and well-being. Starting with that 3-element part of biology, society and environment, understanding that the climate and the weather influence the environmental variables and the loss of biodiversity has an impact. And then thinking quite deliberately about the essential ingredients for health. We need air, we need food and we need water. And then there's 2 elements that either protect us from changes in weather, changes in climate, and particularly can protect us with variables, air, food and water variables, or can make us significantly more vulnerable to extreme temperature, extreme weather events, food insecurity, air quality, and that is where and how we live. Our health system at the moment doesn't pay much attention to those 5 variables. And what I'm arguing is that we need to pay an increasing amount of attention to those 5 variables. Why? Well, air pollution is a significant factor in our health and well-being. And I often make a bad joke that if when I was at medical school 25 years ago, if there was a lecture on air pollution, I certainly don't remember it and I don't think I went. It was never given much attention. We were taught that cardiovascular disease was caused by cigarette smoking and high blood pressure, elevated cholesterol and diabetes. And we didn't pay attention to the environmental factors that also contribute to problems like heart disease. And yet air pollution plays a significant role on our health and well-being. And in fact, the Institute of Health and Welfare report from 2018 estimated that around 7% of our cardiovascular mortality, and cardiovascular disease is the leading cause of death in Australia. So 7% of our leading cause of death is attributable to air pollution. It's a dominant factor. So air quality does have a significant impact on our health and well-being. And PM 2.5 exposure, which we've become quite significantly familiar with through that Black Summer experience, is directly related to cardiovascular events, heart attack, stroke, heart rhythm abnormalities, respiratory disease, pregnancy complications, and some malignancies and cancers. In the global burden of disease studies that have been published in the last couple of years, it's estimated that around 3 million premature deaths are caused by air pollution. And of course, there's this relationship between carbon emission and air pollution. Our air quality is influenced significantly by the burning of fossil fuels. And so if we think about our major cities, Sydney, Melbourne, Brisbane, Perth, etc., it's the air quality variables are strongly influenced, sometimes by environmental factors like dust storms or bushfires, but much more routinely by the burning of fossil fuels, the cars that we use, the trucks that we use, and in places like Sydney, the coal-fired power stations that are in the Hunter Valley nearby. So the air quality that we live with routinely is influenced strongly by the burning of fossil fuels, changing that relationship to burning fossil fuels, therefore has these extraordinary potential health benefits. And so we know that by taking cars out of cities or by transition towards electric vehicles, particularly if we can encourage those hybrid models where we have both a decrease in the amount of petrol and diesel that's being burnt in our city and an increase in active transportation, the potential health benefits, those co-benefits, are profound. And so this is air, and then we've got food. Food is a huge issue in health. And again, we perhaps don't approach it as well. We do talk to patients regularly about weight reduction strategies, and we'll often give advice about food. But we should recognise what a huge driver of disease it is. It's around 55 million people die each year around the world, and 11 million of those premature deaths are attributable to over or undernutrition, being overweight or underweight, and particularly having poor quality nutrition. Now, nutrition on its own is not just an environmental issue. It's such a complex problem, endlessly fascinating for discussions, multiple dimensions. And of course, the influence of social factors, economic factors, corporate, cultural, and other influences is significant. But again, there's this important to recognise relationship between the carbon footprint of food and then the subsequent health impacts. And our colleague at ANU here, Sharon Friel, has a beautiful thesis that looks at the increasing commoditisation of food and the corporatisation of food and the carbon impact of that through increase in manufacturing, production and transportation, increasing then the risk that we face with climate change, and also that these increasingly manufactured and produced foods are often of poor nutritional benefit and that have these longer term impacts on our health. And so there, again, these extraordinary opportunities for co-benefit of both reducing the carbon footprint of food and improving human health and well-being. Food security is the other issue, significant issue, which we see with the changing climate. And again, I think when we're thinking through the way in which the coronavirus pandemic has impacted us in the last 2 years, that supply chain disruption, when I use that phrase now, it has so much more resonance than it did a few years ago. I'd be surprised if many people on the line today have not experienced some form of supply chain disruption to some routine event or thing that they use in their lives. And supply chain disruption is an issue in terms of food security. And so that's still something that even in well-resourced countries like Australia, we can be faced by. And planning for this is important. So the last element is water. And water is such an essential part of our human life. And in that context, I suspect that the research that we do around water quality will emerge over the coming period. Water supply and quality can obviously affect our human health and well-being, and can affect and the climate change impact on our water supply and quality can be profound. And I can reflect on the Australian experience again through that 2019 where it didn't rain, and we had towns that ran out of water, and we had towns that were running on bottled water. And I had a number of conversations with colleagues just from a health perspective about questions like, how do you run a hospital where your town has no water, where the water that's coming in for use is all being trucked in? Can you run things like an endoscopy service? Should you be performing surgery in a hospital where you don't have access to a reliable water supply? And so water is a really interesting and complex problem, and one that requires us all to think, particularly while it's raining. The health impacts of solutions to water conservation and issues like desalination also need further research. And I certainly think that access to desalinated water has a tremendous advantage in water resource deficient environments. But there's some interesting research from Israel that shows a tiny change in things like cardiovascular risk, so heart attack risk, with water desalination. And so we should be aware and start to build in questions about water access into the research that we do for health and wellbeing. I do think this is the most important conversation, and increasingly in our health system, we need to be talking about where and how we live. There's been some extraordinary publications recently looking at Indigenous health and wellbeing in the Northern Territory, and particularly this photo is a man called Norm Frank, who's an elder from the Tennant Creek area. Norm has the honour of being the first Aboriginal man in the Northern Territory to have solar panels on the roof of his house. And the issues around housing in the Northern Territory for our Indigenous population particularly are very much worthy of our time and attention. Simon Quilty and Norm Frank have a publication that's in Child and Paediatric Health, published in the last week or so, talking about their shared concerns about the environment and talking about their shared concerns for their children's future. But it's around issues like what sort of houses we live in. And in Indigenous housing in the Northern Territory, there are problems with energy security where they run out of supply. So in a 2-week period, you may have a couple of days where the power cuts out. And the power is cutting out in temperatures that are 40 plus. And so food can go off. And from a health perspective, this is a population where medication is routinely prescribed, and particularly drugs like insulin. Insulin needs to be refrigerated. It needs to be kept at least under 30 degrees and ideally in that refrigerated environment. And so if as a healthcare system, we're asking our patients to be taking medication that's sensitive to things like temperature, we need to think a lot about the sort of environment that our patients are in. And also think a lot about the environment that our patients are in and how that interacts with their health and wellbeing. What we can do as a community, what we can do as a health system to ensure that people have a safe place to live. In Sydney, this work is also really highly relevant. And in the western part of Sydney, there's an overlap between the social determinants of health, challenges around socioeconomics, levels of education and employment precarity, and a high temperature. So much hotter environment in parts of Western Sydney, over 10 degrees hotter than it would be on the East Coast. And that's a population of people where we see much higher rates of obesity, much higher rates of type 2 diabetes. And you can see how these things are directly related. And so I think as a health system, if we can start to pay some attention to where we live, how we live there, we can see the huge opportunities for health improvement and wellbeing improvement. And so that's my final argument. I think the model air, food, water, where and how we live is a useful one. As we watch the climate change outside, as we live through an increase in extreme weather events, as we see the planet that we live in, the environments that we're in at the moment change, we need to be working together. We need to work across multiple systems to think about how we can protect ourselves and protect the planet, protect our biodiversity, protect our plants and animals into the future. And this model of the essential ingredients, the air, food and water, the where and how we live, I think gives us a framework if we're beginning to talk about the real need for climate change adaptation. And so that's probably a good spot for me to stop, and perhaps Will Grant can give us his thoughts on how we move that forward.
Thank you, Arnagretta. That was a really enlightening talk and provided a really good overview of the health impacts of climate change, and just love the air, food, water model. And I really love how you just didn't talk about the physical health, but also the impact on the emotional and psychological health. And there's so many co-benefits for climate mitigation for population health. So thank you again. I'd now like to introduce our next speaker and the last speaker, Dr. Will Grant. He's a senior lecturer in science communication at the Australian National Centre for Public Health Awareness of Science at ANU. He's the co-founder of the Researcher Employment Service Post-AC and various podcasts at The Wholesome Show, Good Day Patriots, and Good Day Sausages, charting in Australian iTunes Top 50. So check them out if you're interested. He's been awarded for his public policy and outreach work, and he has co-authored and authored dozens of works in various scholarly outlets, written, commissioned, and pitched articles and opinion pieces in high-impact public-facing outlets, focusing mostly on the interaction of science, politics, and technology. So over to you, Will.
Thank you so much, Devati. Thank you so much, Dipti, for this amazing opportunity to speak with you here this evening. It's great. It's great going after Mark and Arnagretta. It's wonderful hearing the sorts of things that they are articulating when we think about the overlap between climate change and health and what has happened in the COVID pandemic so far. Now, what I'd like to do in my talk is think about how perhaps the things that we have gone through over the last 2 years may have shifted our thinking. Because I am accused by my wife, by many people around me, of being a relentless optimist, being someone who always sees the sunny side, sees what maybe is the silver lining of catastrophic events. And so where I think it is really important for all of us in the climate communication world to continue to hold the feet to the fire of the world in terms of getting the action that we need. Sometimes I want to dwell on the sunny picture, the brighter picture, maybe what else we can see going on in COVID. So I want to tell a story about what I have seen during COVID and what this might mean for our reaction to climate change over the next few years. Some of the things, of course, are temporary, but maybe there are some deeper changes that perhaps might last a little bit longer and might have longer impact on how we deal with climate change into the future.
Bill, can I just interrupt you?
Of course you can.
Can you put it on presentation mode? I think it's not showing up on.
There we go. Let's go presentation. So what version you're seeing? So if you see, so you're seeing the notes view, aren't you? Did it work before?
Yes, it worked very well before. Devashi, can you help?
Yes, let's try again. Try sharing the screen wheel. That's okay.
Yeah. What does that look like?
Ah, perfect. You got it.
Perfect.
Awesome.
Perfect. Excellent. Apologies for that. That is so embarrassing. All of my science communication colleagues will laugh at me all the way to the bank. But anyway, in thinking about how COVID has affected our lives, we can look at all sorts of data, and I will turn to some data soon. But the first thing I was thinking about when thinking about this talk is, okay, how have big shocks affected the world before? What have they done to us? And it's a terrible analog because it's similar but very different. My mind turned 700 years back in time to October 1347. Why this date? Well, this was a pretty bad day for all of Europe, most of Eurasia, because on this day, 12 ships coming from the Black Sea landed in the Sicilian port of Messina. I've never been to Messina. I'm sure it's very lovely, but those 12 ships didn't have very many alive crew anymore. Nearly all of the crew were dead, and those who were alive were covered in black boils. As you can guess, this was the bubonic plague arriving in Europe. What started the Black Death? Now, we have all heard the history of the Black Death. It didn't take very long to roll throughout Europe. In fact, over about 5 years, it rolled in waves from Italy through north into Germany, through France, through Spain, up into the United Kingdom, and over to the east, into the Ukraine, into Russia. Famous paintings from the period. So this is Peter Bruegel, The Elders, The Triumph of Death, tell a story of utter devastation. Of course, nothing actually looked like this, but it does bring together some of the things that were happening throughout Europe in that time. There was mass death. There was war, there was famine, all sorts of things that were an utter devastation to Eurasian society. But, and here's the but that I was thinking about. There were some significant silver linings to this catastrophic event. I know that a lot of people would say, well, how could there be silver linings? Of course, this was a devastation to all of Eurasian society, but it did change quite a few things. And those changes were not instant. There were things that took decades, maybe a few decades, up to a century to wash through European society. A lot of them were the sorts of positives that maybe we might be able to find in the COVID story. The first one, I think, is a really relevant one, is a significant change in the distribution of work and the distribution of the labor economy throughout Eurasia. In particular, an end, not everywhere, but in many places, to the serfdom system. The serfdom system was a form of economy where peasants were tied to the land of the nobles, and they were forced to work with no pay other than lodgings and food, very much like slavery. But because of so many deaths, the value of labour changed significantly. A lot of those who had survived were suddenly able to look at the world and charge their own price. They were able to look at society and say, what do I want to be? If the noble wants to pay me, then perhaps I will continue. If the noble doesn't pay me significantly, I will go to the cities. There was an enormous change in labour relations throughout the 50 years after the Black Death. Enormously. People found fluidity and able to get better jobs and change the economy entirely. The 100 years after the Black Death was also a golden age for women, where previously property had been owned entirely by men. Suddenly, all of those deaths had opened up a moment in society where people looked differently and said, well, we need more people to be able to own, to look after capital, to look after estates. Women suddenly had a range of roles in society that had not been seen before. There are stories from that time of women running a range of merchants, enterprises, running small factories, running all sorts of things that they weren't doing just a few years before. And here's the one that I think is really interesting for us in the world of the sciences now, that the Black Death ushered in a revolution in medicine. Okay, a lot of the doctors who were working during the plague did die, so there was a revolution there, but suddenly new modes of thinking about disease and about how we would teach each other and respond to emergencies came about. In particular, doctors suddenly started publishing books, medical treatises in vernacular languages. I know it's not something that we would think as a revolution right now, but before that, all medical texts were often printed only in Latin if they were available at all. A secret language that not many people could speak, but suddenly medical information, medical ideas were coming about in Latin. Not in Latin, in vernacular languages. Now, these are just three small things that were silver linings of the Black Death. And I thought about these and I thought, oh, okay, what are the silver linings of COVID? What are the things that we have benefited from this 2-year shock to our system and from this significant number of deaths? I think there are a few. Now, okay, first of all, some of the silver linings are not really associated with climate and are temporary. So these guys, do you all remember them? Early in the first lockdown, we got a whole bunch of people playing violin, playing tennis, singing operas, things like that on the balconies. I think Italy in particular was famous for this. Maybe you need urban design where you can hear each other from your balconies. Sadly, my balcony, I don't think anyone could hear me playing very much or singing. Maybe not. Sadly, that was temporary. I don't think that has lasted into the second wave or the third wave. If there are further lockdowns, maybe that won't last. What did I do then? I hit the wrong button. Nature is healing. Also a little bit temporary and maybe fake. So early on in the pandemic, we did see a variety of people saying, wow, this is amazing. Suddenly all the humans have left and we're seeing dolphins in the canals of Florence. We're seeing elephants curling up inside a tea garden. We're seeing goats rampaging through villages. We're seeing all sorts of natural phenomena returning. I don't know how true some of these were. Some of them were made up. They were fake footage. But there was a little bit of truth to this, that suddenly if humans move away, perhaps nature might respond a little bit. But that's all gone. And as Mark said before, I sneakily grabbed a screenshot before, the emissions drop that we did see at the beginning of the first lockdown in early 2020 was a significant drop, but it hasn't lasted. It was a temporary drop in emissions. And sadly, as Mark said, it's looking like the projections are heading back up again. So these are temporary effects of COVID on how we think about our environment around us. But this is what I really wanted to turn to. What are the things, like an ending of serfdom, like a long-lasting change in gender relations, or new ideas about medicine? What are some of the things that might last a little bit longer? And of course, There are many things out there that I think we could all point to. I'd love to pick your brains about this, because I think everyone will see glimmers all over the place. I wanted to turn to a few that I do think have some impact on how we deal with climate change. Now, these are all things that maybe won't last. Maybe they are temporary as well. Or maybe they've just given us enough of a glimpse of what we could do, so that perhaps over the next 5 years, over the next 10 years, as we continue to deal with climate change, we can start to use this as an insight into what we could do. So the first one, I love this. Riffing off Arnagretta's picture at the end there, this bike lane is a solution to climate change. Cities around the world used the opportunity of the first lockdown, and then also later lockdowns as well, to institute a variety of what they called pop-up cycling infrastructure. So these were typically bike lanes that were made in a very quick fashion. So not even as advanced as the ones that you might see a dedicated lane or with proper concrete barricades. These were bike lanes that were put up with small amounts of signage, but enough to keep cars away from those bike lanes. And we saw a significant jump in the number of cyclists in the months around the world in many, many cities. Will this last forever? Maybe, maybe not. But I think if we are to go with Arnagretta's point before, if we are to get people doing more active transport, I think the pandemic was a moment where suddenly a number of people could jump to that. A number of people could get that moment to change. I think that cycling might be one of those things that might continue into the future. Another thing that happened at the same time, and of course, this is because we saw so many fewer people driving cars, road crashes around the world decreased enormously. Far fewer car crashes, far fewer cars crashing into people. Of course, that's because fewer people are driving to work. But it is nice for us to realize that that baked in system of ongoing car crashes maybe doesn't have to be something that we will always have to have into the future. Here's one that I like. And I wonder how many of you are thinking in the same sorts of ways. Not everyone is able to do this, but during the pandemic, many people shifted to working from home. Many people were essential or in jobs where, of course, they couldn't work from home, but there were many who did. This is a nice statistic from Pew Research. So 20% of the people that they surveyed worked from home before. 71% of them worked from home during the lockdown. Of course, the remainder are either in jobs where they couldn't work from home or were no longer working during that period. Here's the interesting thing. A significant shift in thinking. After the coronavirus, after the pandemic, we have still 54% of people who want to continue working from home. Now, the commute is a significant impact on transport economies and on carbon emissions. Can we get more people to think in this way, where we think, okay, perhaps we can reduce our carbon emissions by traveling less? I think that there are many things here that suggest we want a different relationship with work, and we want a different relationship with transport to work. Perhaps in all of the data that we're seeing around the world, and people are now thinking differently about how they go into work and where they do their work, perhaps there are some glimmers of hope there in how we might live our lives, particularly in terms of our carbon emissions into the future. This, of course, is reinforced enormously by changing norms in work cultures. As we all know, Zoom or any other type of online video conferencing platform jumped enormously during the pandemic. It was, I think, one of the biggest investments that people could make in April 2020. You put your money there and you've made dynamite. There are studies around suggesting that people are continuing this and continuing to choose online meetings where previously they would have flown. And I think this has a significant impact into the future. Yes, we've all been to terrible online conferences where you have to wake up at 2 o'clock in the morning and pretend to sit in a room and listen to other people. But we've also all seen the significant benefits we can get from interacting with colleagues in the same city or in different cities or around the world via online technology. And I think it is important to recognize that without the pandemic, people wouldn't have done this. We can see that growth of Zoom, July 2019, October 2019, January 2019. It's not growth. It's not going anywhere. People weren't changing their attitudes to video conferencing. It was a tool that was used in rare occasions, and most people didn't have the ability to say to their colleagues, to their co-workers, to their boss, hey, can we do this on Zoom? It'd just be a lot easier if I stayed from home. Or maybe if I didn't fly to that other city and did this meeting on Zoom. I think this change in norms won't be permanent, and it won't be perfect. It won't be that we'll replace everything, all international trips with Zoom or with other sorts of webinars. But I do think we have suddenly opened up in a moment where people have the ability to say to each other, let's just do this by video conference. What does that mean for climate change? It means something significant. When norms change, then suddenly we can live in ways that have a lower impact on the environment. This is reflected, I think, in the ways people are thinking about their work. Now, this is a statistic that a lot of people in America are talking about that I don't think is applying so much to us here in Australia, but in America, they have reached this thing called the Great Resignation. Quit rates, people quitting their jobs, have reached the highest point they have done, I think, in decades. Certainly, I think it's definitely since 2001 on that chart there. Now, what does this mean for climate change? What does it mean for how we think about climate change into the future? Again, I think this reinforces an idea that people no longer want to prop up, as much as they were, the certain forms of capitalist economy that are driving us towards devastating climate change. I think people are starting to look differently about their workplaces, how they work, where they go, and perhaps change for the better. I don't know if that applies around the world, but maybe, as long as the billionaires don't get too much richer, maybe we can change relations a little bit there. Of course, we also learned that governments could intervene quickly when they want to. We saw straight away governments around the world investing incredible amounts of money in necessary and important pandemic solutions. Some of those could, as Mark said before, have been tilted far more towards environmental benefits, towards climate change mitigation and adaptation. But still, we did learn that governments can turn quickly if necessary. We can change our investment profile. We can change the sorts of things that governments think about doing on the dime. Can we do that on climate change? I'd like to end here on the point that COVID, of course, can't stop climate change. Even in the dream scenario, where perhaps all of that investment at the beginning of of the COVID pandemic had head in the right direction towards environmental solutions, even then, it couldn't have done that. But I think it's really important for us all to look around our lives and start thinking, what are the small changes that I have made that perhaps I can continue into the future? And how do they relate to all of my colleagues? How can I encourage more? How can I look at what we did in this last 2 years and think, yeah, that's going to help. That's going to help as we start to deal with climate change in the years to come. Thank you all.
Thank you again, Will. What an interesting talk. I loved the historic twist to it and those beautiful ancient paintings and pictures and the practical tips on what we can do. Overall, very, very useful information. So yeah, thanks again to all the speakers, Mark, Arnagretta, and Will, for the incredible presentations and insights. And thanks to the audience who have put in some very interesting questions. So quick side note, now all the audience will see a webinar rating poll launch up on their screen. Please do select your preferred response. This helps us with the monitoring and evaluation of the program. And I assure you that all your responses will be recorded anonymously. I'd now like to invite the whole panel back on board and hand it over to them to answer the questions.
Where would you like us to start? There's a few health specific ones I think that I'm happy to go through. The question about whether we're going to need specialists who can manage health issues relating to climate change in the future. I think a part of what I'm suggesting is that in fact we need to build the environmental determinants of health into all of the work that we do. It needs to be in general practice, in hospitals, in specialist centres. We can't ignore the impact that the environment has on all elements of our health, be it from cardiology and geriatric medicine through to orthopaedic surgery and cancer therapy. We need to be thinking much more overtly about the influence that the environment has. And so I don't think we'll need specialists for climate change, but we do need to put climate change and environmental variables across our healthcare sector. And I think that transition is underway. Would somebody else like to answer a question?
Arnagretta, I think there's one related one on public health focus on impact of climate change. Would you like to take that?
Yeah, no, look, there's a tremendous amount of work that's done in the public health focus on the impact of climate change. So I have to shout out to all of my public health physician friends, and they do extraordinary work. People like the Lancet Countdown on health and climate change have really changed our global understanding. At COP26 recently, there was a very large health contingent that I think have really shifted the discussion and the global appreciation of how significant the health impacts of climate change might be. And I have to say, when I talk to people about climate change, if there's one reason to act on climate change, it is our health and well-being. It's our human survival. And so health and climate change, from my perspective, are absolutely deeply interrelated. It's the dominant driver for action, and we see all these tremendous co-benefits. So there's a lot of public health work that's been done in health and climate change. And I think that the challenge is actually translating that from not just our public health perspective, but in and across into our clinical medicine and into our health services. And that, as I said, I think is underway now.
I think, Mark, the initial questions might be for you.
Sure. So there's a question there, which is, in hindsight, what could you have done better to foster the green economy? It's a very difficult one to say. I think in the sense of what was flagged in countries like Australia was relatively clear. Like there was a lot of support. There was business support. There was academic support and public support for moving into a sort of green trajectory. But largely for political reasons, it didn't happen. And I'm not sure that much you could have done that much else. I'm not sure that we could have pushed that into a different trajectory. I think, to a large extent, what could have been done was largely done in the circumstances. It's very clear that in other countries, there wasn't the same sort of response that we've seen in Australia. So other countries, we saw Will's, increase in road, bicycle cycling type activities. People, adopting more green activities. We've seen very significant infrastructure in different countries. So essentially, priming the move to renewables as a COVID response to keep the economy growing in sort of ways which were not particularly prone to spreading the disease. And so I think other countries sort of looked at that set of opportunities and ended up with a much more balanced portfolio than Australia did. But even having said that, globally, the numbers that I've seen indicate a lot more money went to maintenance or continuing or development of fossil fuel infrastructure than went to say renewable energy infrastructure. So the decisions that were made one way or the other by governments tended to favour the incumbents, favour the fossil fuel industries. With all of the issues, Arnagretta raised some of the health issues with air pollution and PM 2.5, etc. So even though we could see those linkages, we knew that there were benefits from moving away from those particular industries. We didn't generally choose to do that.
What about the impact of the pandemic? So just the environmental harm of treating and preventing COVID in the developed world. Do you have any thoughts on that?
Yeah, I posted in the chat a link to a paper which had been done on plastic use associated with PPE, and that particular study, whilst it was a global review, it focused on the numbers from South Africa, And what they concluded was the amount of plastic in PPE was relatively modest compared with the amount of plastic normally being used in that economy. So proportionately didn't increase it very much. But they did also stress that because the number and variety of plastics associated with treatment of COVID, including PPE, was very large. It hadn't really been effectively incorporated into waste management streams. And so it was a new addition that really didn't have an immediate management response. And I suspect that's actually quite a common response. Having said that, I've been to a few events recently held by the medical professions in Australia. So this is the Doctors for Environment Australia and the Australian Medical Association and the Climate Action Health people. And it's really clear that right across the medical profession, there's a whole bunch of people who are really keen to move, not just in terms of managing the heat stress and cardiology issues associated with climate change, but also managing the footprint of health systems. And so there's a paper that came out a year or two ago now, which indicated that Australia's health systems were responsible for around 7% of our national greenhouse gas emissions. That's a really pretty big number. It's half the number for big sectors like agriculture, almost half the number for transport. So the medical system is actually a big producer of greenhouse gas emissions, and so there's a lot of interest in how to clean that up, how to tighten up their systems, how to reduce wastage, how to move to renewable energy rather than fossil fuel-based energy systems for things like sterilisation or hot water supplies, etc. And so I think you've got a whole bunch of really bright people who are often in quite significant positions of influence. And I think that could be a great leverage point to get more action on climate in Australia.
Thanks,
Can
Mark.
I follow on just a little bit just in terms of healthcare sustainability, because I know I didn't mention it, but it's a really interesting area. And so when we're thinking about the carbon footprint, and you're right, Mark, it's that Forbes Magain article from the Lancet in 2018 that said around 7% of Australians' carbon footprint is from the healthcare sector, which when you think about it, given the healthcare sector in Australia employs about 10% of our employment, perhaps a little bit more, in fact, when you think about it, including aged care, that's actually fairly reasonable. There being a really strong relationship between consumption and carbon footprint. And for anyone who's interested in thinking about this more, can I highly recommend the Commissioner for the Sustainability and the Environment here in the ACT released a report on Scope 3 emissions a few weeks ago. It's the most extraordinary read. And so we do tend to focus on our renewable energy reduction, which is our Scope 2 emissions, and we've got Scope 1 emissions within the healthcare sector, things like our anaesthetic gases and the puffers that we use for treating asthma and COPD. And so those are the things that we can work on often, and we focus quite a bit of attention on. Scope 3 in healthcare is really large, as it is in most parts of our industries, and that's the stuff that we use. So as a healthcare sector, in fact, probably the strongest thing we can do to reduce our carbon footprint is to work on our preventative medicine side of things. So if you can cut down the use of pharmaceuticals and cut down the need for hospitalisation, then you make a huge difference to the carbon footprint of the healthcare sector. And so for coronavirus, the most effective carbon footprint reduction strategy is the elimination strategy, or a really significant virus suppression strategy. So to reduce the risk of infection and to decrease the risks of hospitalisation. That has the biggest impact on our carbon footprint related to the coronavirus pandemic per se. But as a sector, I think our focus should be on using medicine wisely, on avoiding low-value healthcare, which some people estimate is 25% or so of the work that happens in our hospital system is roughly low-value or no-value healthcare. It's not improving people's quality of life or quantity of life. And it's often highly consumptive. So it uses stuff with a carbon footprint, high Scope 3 content. So difficult to control the carbon footprint of that, and yet we can avoid it by changing the way that we practice in the health sector to use medicines wisely and to use our tests appropriately.
Yeah, And just to follow on from that, and Arnagretta, you probably know this better than I do, but there was a presentation which actually indicated that those systems which had the most unproductive, low-value healthcare or wasted healthcare were also those systems which tended to have the highest greenhouse gas footprint per patient treatment, and so you're sort of getting a double whammy there.
Yeah, no, absolutely. And unfortunately, within the healthcare sector in a developed country like Australia, like it is around the world, there are such extraordinary opportunities to reduce our carbon footprint, not by changing to solar panels on the roof, but changing the way that we practice, changing often towards good conversations and good, well-informed, evidence-based discussions, focus on quality and quantity of life, and the informed use of medicines and procedures. That potentially cuts the carbon footprint of the healthcare sector by more than 25%, almost certainly a higher proportion. So it's not hard, but that has flow-on effects to employment. So I'll go back to the original statement about employment, which is, part of what we do in terms of our consumption is about driving our employment. And this is why it's such an interesting conversation for us as a community. Perhaps we should work less.
On that note, I've just got a comment for Will. Thank you, Will, for providing an optimistic view of the unintended impact of human adaptation during COVID-19 on climate change. And there is a follow-up question from that. What is the one thing, you've already given us a few suggestions, but what is the one thing we can do as individuals, as health professionals from tomorrow to manage climate change in the context of a COVID, post-COVID world? And Arnagretta's answered that to some extent. But
I'd say that both Mark and Arnagretta can absolutely add to this. But the things that we can all do all the time is be the change we want to see in the world. So start working in our practices to reduce our carbon impact wherever we can, but also vote and talk about it. We have to make sure that we do embed climate change in all of our considerations. We all work in workplaces where we make decisions about next purchases, about infrastructure, whatever it is, whatever we are doing, we do need to think about the carbon impact at every moment we can, and to advocate for it. It doesn't mean that it's not harping on at people or anything like that. But I think if we all take our chances to always remember that climate change cuts across everything, then we'll be moving somewhere.
So we've got a couple of very interesting questions. In Australia, we are very lucky in the resources we have available to us, but there are a couple of questions on our resource poor settings. So how can we manage climate change in resource poor countries dealing with the pandemic? There are obviously greater difficulties at play there. And the second question is, how does the environmental framework interact with the UN millennial goal of poverty eradication? So very important questions there.
Arnagretta, do you want to take the first one?
Yes, I'm happy to look at that. I think I'm not expert in global health, and so I should start by apologising for inadequate understanding. But I think broadly speaking, the commentary that we've gone through here offers some perspectives across the country, the world, across the globe. That it's actually in resource poor environments where we see the environmental impact on health can be quite a profound thing. And the solutions in these environments will be local. It'll be about local discussions and local decisions. And I think that's part of our solution to the global problem of climate change, is really coming up with powerful techniques that allow that transfer of decision-making power from some sort of ethereal hierarchy, the people who are in charge, down to community levels, so people feel empowered to make changes locally that are focused on their health and well-being. And if we give our local communities, even anywhere around the world, the opportunities to do that, like we're seeing in the Northern Territory, as the Indigenous populations there begin to push hard for adequate housing, for energy security, and for new renewable energy with a low carbon footprint as part of that. These are the sorts of changes that we can see take place, and it's about empowering local communities. I can make a really brief comment. Again, I'm not expert in the development goals for the UN, but one of those United Nations development goals is, of course, about environmental protection. And the synergies between the two things, I think, are real. I think whenever I think about the way in which I would solve climate change, or the way in which I would begin to address the significant challenges of climate change, it's exactly as Will just said, it's across all elements of our life. And when you start to build climate change and the carbon footprint and the environmental consequences into all of the decisions we make, we actually see health and well-being improve. We see resources shared more equitably and distributed in a way that improves health and well-being for everybody. So I think there's a tremendous synergy across those development goals.
Yeah, just a quick comment there following up is that there's 17 of the Sustainable Development Goals in that particular framework. Number 13 is climate change, so it's just one of many, and those were all intended to interact with each other. So climate change does relate to water, and it does relate to poverty, and it does relate to food, and it does relate to education, etc. And so it's that sort of integrated response which we need to be thinking about, and that actually requires policy leadership. It simply won't happen in the absence of effective policy leadership.
So perversely, we have someone who's asking about this. There are a lot of systemic barriers for doctors working in the public system to try and implement changes within their own health networks. Do you have any suggestions for how medical staff can begin to make changes, and what should we be prioritizing?
Look, there's so many ways to answer that question. I think we've already touched on quite a few of those answers. We can look at the issues around sustainability in our healthcare sector. And as Mark said, there's such an extraordinary amount of inspiring work that's happening in that space. There's great models out there. The United Kingdom, the National Health System, has a genuine target to become a net zero health system in a short time frame. And there's a lot of relationships that are shared and information sharing across those two things. So an increasing number of health services are recognising the need to measure and account for their carbon footprint. But I think for doctors and for nurses and for healthcare professionals working in healthcare systems, the more we see the impact that the environment has on the health and well-being of the people we look after, the more seriously we're going to want to take this. And so I actually think it's a powerful thing if we start to use environmental metrics. So if we're looking at, for example, cardiovascular event rates in a hospital system, and we often look at things like smoking or blood pressure, we should build into those research models temperature variability and air quality. And once we start to build that in, I have quite a lot of confidence on the basis of what we know already from epidemiological studies that we'll recognise the significance that plays in the health and well-being of our community, and that will really drive significant engagement from the health system into climate mitigation and adaptation that's needed.
And on a similar vein, Arnagretta, how do we as health professionals empower our patients to care for their health better as the nature and intensity of natural disasters grow? How do we build in those conversations, both for believers and for naysayers?
Yeah, look, I can talk about the environmental health impacts of health without talking about climate change. And so it's like some of the challenging conversations that many of us are having around vaccine hesitancy or overt vaccine denialism or COVID denialism. We need to refine our messaging for patient populations. But I think people recognise that heat, for example, impacts on their health and well-being, cold impacts on their health and well-being, air pollution impacts on their health and well-being. And so we can take people on the journey quite easily, I think, by talking about those variables. And I think we need to work that into the conversations we have. And I can tell you that there is a tremendous opportunity here for health professionals who are interested in working on the research and the policy work that needs to be done on giving good quality advice to people about how to manage that heat wave that I described in 2019. There simply isn't good clinical guidelines out there, and we need those clinical guidelines to be developed, and we need them now. So great opportunity for anyone who's watching for research projects and information. Yep.
Yeah, no, thanks, Arnagretta.
And just to add to that, I think really important to recognise that there's mental health dimensions to this as well as physical health dimensions, and some good studies coming out now which relate things like heat stress to domestic violence, or heat stress to criminal activity, or heat stress to broad measures of stress in populations, or incidents of mental health following major climatic disasters like a typhoon or a hurricane cyclone hitting a place. And so we need to ensure that that health response covers both the physical and the mental components.
We certainly saw a bit of that after the bushfires, didn't we, Arnagretta? The last question is more of a comment, and I guess there's opportunities and challenges there. Modern technology, is that going to help reduce climate change, or is it going to provoke climate change? So I guess it depends on how we use it, but I'd be interested in your thoughts.
I'll jump in there with a personal view. Like my view is technology. It's not about the technology; it's about how you use it, and this applies to climate change and across almost all domains of human activity. We often get enamored by the technology and not think clearly enough about how we use that and what the consequences of that use are, and many of the problems we see across the earth are through uses of a technology which didn't foresee the consequences, just like many of the fantastic things that we benefit from across the earth are also related to technology. So it's that classic double-edged sword. It's how we use it that really matters. We need to become smarter and wiser as a species and start thinking much more carefully about how we use tech.
I think it's worth just adding off what Arnagretta said before about the what is it, the low benefit healthcare or useless healthcare?
Low and no value. Yeah, useless.
No value.
Useless is a good word. Yeah.
I think there's a bunch of things across society where we can look at this. We can say, hang on, why are we doing this? Why are we doing that? And realizing that if we're smarter about how all of our system works together, we can realize there are consequences here or over there, but we can do better about all of this. We can realize how our inputs here will lead to consequences there, and we can make better choices and do, high value healthcare and live more sustainable, environmentally beneficial lives.
Thank you, Will.
Can I riff off Will a bit here? And
of course.
And so do a little bit of a historical sort of analogy or lesson. So when I was younger and I was reading things like the Homer's Iliad and, so these are texts which came from 1500 BC, 3,500 years ago. And the dynamics of the interactions with the people were exactly the same as the dynamics of interactions we have today. The social constructs had their benefits and their, destructive characteristics, just like we have today. The difference is now we've got 21st century weapons, everything from AR-15s to, hydrogen bombs, but we've got Trojan War mentality and Trojan War social structures and Trojan War emotional responses to, situations which require a rational response rather than an emotional one. There is a lot to learn from in comparison with history.
And to connect that in some way to the future, I guess I should acknowledge the medical student and other student volunteers who are working with the program, because they were the ones who actually suggested this topic on the impact of climate change, on the impact of COVID-19 on climate change. And I've certainly learned a lot, and I'm sure people who attended today learned a lot, and those who access our recording from our website afterwards will learn a lot. So with that, I'll hand over to Devashi to thank everyone and to close the webinar.
Thank you, Dipti. I certainly agree with you. Learned a lot today. Thank you, Mark, Will, and Arnagretta. That was really good. Very interesting talks. So yeah, now, Dipti, would you like to close the program or?
No, go ahead, Devashi.
Okay, all right. So yeah, just a quick note on the ANU COVID-19 peer support program that we're running. If you're a medical or healthcare professional and you would like to know more about the program, please visit this website. You can also register as a volunteer or seek support using this link. And you can contact us via this email and follow us on social media for updates. And we'll be signing off now. Thank you.
Thanks
everyone.
Thanks, everyone.
Thanks a lot. Cheers.
Bye.